and welcome to this edition of Social Security Today. I'm your host, Jeffrey Rodriguez, the Public Affairs Specialist here in Orange County for the Social Security Administration, and it is a great pleasure to be with you this morning. We have a lot of information that we want to go over, and I have a special guest that I'll introduce in a little bit, and so I'm excited about introducing our guest and getting into that information for you that I'm positive, I am sure that you're going to find very important and pertinent to things that matter, which is, and I'll give you a hint, it's about Medicare. But coming back to some of the Social Security issues, I just received yesterday information about the cost of living adjustment, that there will be a zero change, and so you'll start to see that news if you haven't. It was so hot off the press, I didn't even have a chance to put up a slide or present anything in that way, but I did want to make sure that you receive that information, and so that you can start to make plans and realize or know that you won't have any increase in 2016. So cost of living adjustment, 0%. And there's more information if you go onto our website, which you'll know I always ask that you do so. There's great information there. You can look up through our website the information on that, our press release, and read that information. I would suggest you do so you get some of the background information about why and how that became and what really drives that. So coming back to Social Security, the My Social Security, I start off my segments by reinforcing, if you have not set up a My Social Security account, very important that you do so. It's the place where you're going to go and you're going to be able to manage all your accounts. If you have any type of updates, address, phone number, or you just need to order a Medicare card, a replacement Medicare card, or maybe you need that 1099 or a statement, maybe you're taking out a loan or doing something financial and they're asking for a statement or proof of your benefits, you can do it right through your My Social Security account, so very valuable to you. And again, you don't want anyone else coming in and setting that up. You want to have access and protect it by setting up the My Social Security account for yourself and putting on your own password there so that you have that information. Very easy to get to. You go to our home page, you click on the My Social Security account, and then after that, you're going right back into it and setting it up, whether you're creating for the first time or you're jumping back into your account. The next information, and I mentioned about the cost of living as far as the announcement, if you go to our website and you look up the Social Security Matters, which is our blog, you'll find information there, and you can register to have that blog sent to you, to your email, to have it sent up to you and be able to see that as we make announcements every day, and there's different information that goes up there, whether it's weekly or special announcements. So I would suggest that you set up that Social Security Matters, because we know it matters to you, it matters to us. We want you to have the information that we're putting out, not through a media type of kind of convoluted and hyped out and the wrong information or myths from someone else. We want you to hear the information from the correct source, which is Social Security Administration. So there is something coming up which hopefully you've taken advantage of in the past, and it's very important. That's the Medicare Marketplace. And so on Thursday, October 22nd, and starting at 9 o'clock, we'll open up the doors, and there'll be presentations starting as early as 10 o'clock in the morning. We have a full program. It's going to be at Clubhouse number 5, again, from 9 o'clock up through the noon hour, and then at 12:30 to 3, there's going to be through HICAP, and we'll explain what that is in just a second here. You'll have the annual enrollment clinic that you're able to set up, so you can call and set up an appointment so that you can do some comparison. We'll jump into that. I don't want to say too much about what that is, because that's really what my special guest is here for. So I'd like to take the time now, instead of taking time up with other things, I really want to jump in. And today my guest is Susan Zyfin, who is the Education and Outreach Specialist for the Council on Aging here in Orange County. So Susan, welcome. Thank you for being here this morning with me, because I know there's a lot of information that you want to share with the viewers today. But they may not know you. I know that you've been with Council on Aging now, what, about a year?
About a year, yes.
Excellent. So why don't you tell me a little bit about you? where did you come from before here? What's your background? What makes you that specialist?
Well, good morning, Jeffrey, and thank you very
Thanks.
much for the invitation. We're very excited to be here today to bring good news to seniors. My background is I originally qualified as a nurse and a midwife in London, in England, then went to work in Canada, where I worked in intensive care, and then came to the United States, where I worked at UCI, also in intensive care and diabetes education. From there, I transitioned into industry and worked for Allergan and Abbott Labs in medical devices, primarily teaching ophthalmologists how to use our new products and devices on the market. When I retired, I began to volunteer with the Council on Aging and ultimately joined them as a full-time staff member.
So you definitely have some experience in this area, and it sounds like that's where your passion really came from, to get that information, that experience, education that you have. I kind of noticed that you're a little bit of the UK still in your in the way you speak, and I think you're trying to overcome it, trying to fit into the Southern Cal here, but that's good. So that passion really drove you into advocacy, is that correct?
It is, and having had that experience, I've seen the healthcare system from both the provider point of view and the beneficiary point of view in 3 different countries. And so it's been a wonderful experience to be able to join the council and to bring that to my educational efforts through the HICAP program, which is called Health Counseling Advocacy Program.
Excellent. So when we take a look at that, it's part of what's called SHIP, which is the national level.
Correct.
And that is the state health insurance assistance program, and then HICAP is really what really goes to the ground, that ground root, that level of getting the information, the advocacy out to everyone. That's the HICAP, which you're part of. So let's kind of get into that and talk about it a little bit. So who is this Council on Aging? Who is the HICAP? What is it that you do?
Well, the Council on Aging, firstly, is the umbrella organization in which HICAP, Health Insurance Counseling Advocacy Program, resides. The Council on Aging has been serving seniors with education and specialty services for over 40 years. It is a non-profit. The information that we provide to seniors is accurate, and it is completely unbiased. We are not selling anything to any seniors. We are their advocates.
So you don't get kickbacks from any company, so you're able to give the information straight as it is. Is that what you're saying?
Yes, that's correct. We're able to make the senior an informed purchaser and helping them navigate the Medicare system in an informed manner with no bias.
Okay, so I see here in per one of the slides that you shared with us, it kind of breaks down into 3 areas, if you will, as far as the impact.
The agency has a education, answers guide, and Smile Makers Guild. They also have 2 wonderful mental health programs called Friendly Visitor and Reconnect. And then, if you know isolated seniors in the community, this is where we bring them into the agency and hook them up and facilitate and re-educate them and bring them back into the community and get them part of their synagogues and churches once again. And then we have our advocacy, which is the HICAP program. We also have a benefits enrollment center where we assist people on the lower income in Orange County. And then we have Ombudsman, which was the original program set up with the Council on Aging, where we actually go out to all the senior care facilities in Orange County because there is little or no oversight in many of them, and we are the only agency that does that.
So the Council on Aging is not just the Medicare HICAP assistance. There's many other things that the Council on Aging is doing, which leads me to believe that someone could reach out to the Council on Aging and get a lot of help, not just in the area of Medicare, but really in a lot of these other areas.
Absolutely.
So, okay, great. So let's kind of start to drill in, if we can, a little bit about what kind of impact has HICAP had in Orange County?
HICAP has had an enormous impact in reaching the seniors in Orange County, primarily through hosting HICAP volunteers in almost all of the senior centers in Orange County.
Fantastic.
And they give regular free counseling sessions throughout the year in whichever senior center they service, and talk to those clients about Medicare and help resolve their problems. So those are private one-on-one counseling sessions.
Wow.
We also serve the community through a phone bank which runs from Monday to Friday. People get a call our 800 number or our 714 number. They will speak to a live person who is specially trained, a volunteer specially trained to give them unbiased, comprehensive information on Medicare.
Well, that's a lot of things. No wonder when I saw the stat that you serve over 6,000 of the seniors here in Orange County. That's a huge number. I'm thinking you have to have multiple people all over. And so it's really ran by volunteers.
The lion's share of what we do is run by our volunteers. We have a core set of full-time people, but it is the volunteers to whom our hats come off, because they do a fantastic job. They get integrated into the community. They know and serve their community very well, and they are very well trained. We have to take specialized training in Medicare, become certified before we're allowed to go out and talk to the public.
And what I find really when you're talking about volunteers, that means someone really wants to be there. They're giving up, sacrificing their own time, their own effort, their own oftentimes money, in a sense, in order to be able to do this type of outreach. I think that is just excellent. Now, one of the things that you do in your outreach, which is that roadmap to Medicare. Explain that a little bit. What is the roadmap to Medicare?
I would say Roadmap to Medicare is one of our core programs, our flagship program. It happens twice a month regularly, the last Wednesday and the last Saturday of every month. Any senior coming up to enrollment age in Medicare should be sure to sign up for Roadmap to Medicare. It's everything you wanted to know about Medicare but were afraid to ask. This is the place where you ask those questions and you get accurate information. Oftentimes, seniors stumble into the Medicare system not knowing what options are available to them, and some of them are irreversible.
And you bring up a great point, because when I go out and speak from the Social Security standpoint and the way that we handle Medicare, really what we're doing, our job with Medicare at Social Security, is to enroll the person, to see if they're eligible to the benefit, and then we enroll them through different processes, and we'll kind of talk a little bit about that, different enrollment periods, or we can cover that later. But when we look at it, I give that 30,000 foot level just kind of a real broad, here's what Medicare is. And so there's a lot of confusion within the options, within how Medicare works. And so I so strongly believe in the roadmap to Medicare that I strongly encourage every time that I speak, I put up your information, I tell them they should never take Medicare unless they've gone through and received that information, because that's really the true information that they're looking for Medicare, as far as I'm concerned and I see. Would you agree? Is that kind of
I would completely agree, and I think if you stumble into Medicare without knowing what your options are, you really are at risk for making poor choices, or choices that don't serve you well or serve your family well as you go through the system. So, and as I mentioned before, some of the choices are not reversible. So it's very important that you become knowledgeable before you join. So we really, and we appreciate all the work you do to put the word out. Come to our free Roadmap to Medicare classes. They're twice a month, every month, and it is a very good way to start your Medicare experience.
Exactly. It's no cost to them. I don't see why someone wouldn't take that extra 2 hours to truly be prepared and understand what they're going to be getting into that's really going to greatly affect them, especially down the road. And as you said, they can't reverse.
Some
so
of
they
them
better
they
make
can't
sure
reverse.
that they
Yes.
get in correctly. So let's talk about this. Besides the person that enrolls and starts receiving the Medicare, there's this annual enrollment. What is the annual enrollment? What are we talking about there?
Well, this is perfect because it started yesterday. Annual enrollment happens every year for Medicare beneficiaries. It goes from October the 15th to December the 7th. During this time, it is optional. You're not required to make changes. It is optional. All Medicare beneficiaries can make changes to their health plans and their prescription drug plans. And it's very important at this time of year that they become knowledgeable about what they have currently. So they need to read the information that comes in the mail from their health and drug plans about any changes that they've made or plan to make in 2016 coverage.
So the date, as you said yesterday, October 15th was the first day of open enrollment. It will end on December 7th.
Correct.
So this is the only time, and this isn't for, when we say open enrollment, we're not talking someone who's going to start Medicare. That's a whole initial enrollment or their special enrollment period or a general enrollment. Very different from what we're talking here.
Yes.
This is open enrollment for someone that is already receiving Medicare.
Correct.
And now they have options or potential options to maybe make an enhancement, a small change to their Medicare. Is that what I'm hearing?
That is correct. They have an opportunity, if they're in original Medicare, to switch to a Medicare Advantage program. They have an opportunity, if they're in a Medicare Advantage program, to switch back to original Medicare. They have an opportunity, if they're in a Medicare Advantage program, to switch to another Medicare Advantage program. They also have an opportunity to sign up for a prescription drug
Well, okay,
plan.
so this is a lot. So let's take this
change.
one by one. So the change that you can make. So first you said switch from original Medicare to the Medicare Advantage plan.
Correct.
What does that mean? What is this? What is that? Who is that person?
Medicare has two options for people. Excuse me.
So they have two options. So original Medicare would be,
As the name implies, it was the program that came out in 1965. It's an 80-20 system. The government pays 80%, you pay 20%.
so that's the Part A and B. If someone
Correct.
has chosen and they're elected to go that option, and they have Part A and B. So they've had that for a couple years now, 3 years, a year, whatever it may be. And now they have a chance to switch into an Advantage plan.
Medicare Advantage programs.
Okay.
Medicare Advantage programs combines A, B, and almost all of them in Orange County also combine D. So it's a one-stop shop. You are required, however, to receive all your care through their providers and their facilities. So should you be
Okay.
making a change from original Medicare to a Medicare Advantage plan, it's wise to find out if the Medicare Advantage plan you're planning to change to has the providers that you have had while you've been in original Medicare.
So they're going from A and B, which gives them a little bit more flexibility to choose or elect where they're going, but maybe a higher cost because the 20% that they're going to have to pay of that cost. Or they choose a Medicare Advantage plan, which kind of covers, almost like a HMO, if you will, covers, and they'll be able to go in and have, but they're going to be constricted, or they have to use those facilities, that care, whatever they're under. So then those are kind of the back and forth between those two. But there's one that I think is the next one, or I'm not sure if I understand that one fully, which is the Medicare Advantage plan to another Medicare Advantage plan. What would be their options there? What does that do?
If you're currently in a Medicare Advantage plan, you have an option to change to another Medicare Advantage plan. And you may wish to do that because perhaps the drugs that you're taking are not in the formulary of your current Medicare Advantage plan, and you want to go to another Medicare Advantage plan for whom your drugs are included in their formulary.
Okay.
That sometimes is a reason that people want to make change, or they simply just want to make a change and go to a different Medicare Advantage plan.
You know, and most people like myself, once you get into a plan, you like your doctors, you like the way it works, you become accustomed to it.
Yes.
So most of the time, we're not switching from that. So the next option is what drug plan changes someone can make. Would be kind of where we see most of the people choosing or electing?
I think you make a very good point, Jeffrey. Most people, once they've settled in a health plan, remain in it for some time. And if they're making a change, they usually make it for a good reason. However, there's more, you see more fluidity in the changes of prescription drug plans because prescription drug plans change their formulas year over year. So if you start the year taking very little drugs, or you take none at all, and you proceed through the year and you find yourself on drugs that may or may not be covered on the formulary that you're on, then you may want to, at open enrollment, change to a prescription drug plan that is covered under their formulary.
So that would be someone has Part A and B and has a Part D and looks to see where can I save some money by changing to another Part D. They don't affect the Part A and B. They're going to stick with. They like having a little bit of that flexibility, or maybe they travel between in and out of states, and that's why they choose the A and B. They're snowbirds. They're, you know, whatever the case may be. So it's looking for a different Plan D.
Yes, that's an excellent description. That's called, we've described that as a standalone. So if you're an original Medicare and you have got a Part B, and then you've probably taken out a supplemental or gap insurance, and in addition you have a Part D for drugs, that's called a standalone. When you make changes to that Part D for drugs, you're not changing your gap, you're not changing your Part B, you're not changing Part A, you're still an original Medicare.
Wow. That's a lot of information, a lot. Now I can see why they need someone like HICAP, Council on Aging, to go to, because if they're trying to make these choices by themselves, I think they'll become very confused and not really select maybe the best one for them. And just because of time, I don't want to go too far into there or those, but let's talk about how Council on Aging helps, or what are the steps, if you will. What are the steps that during this whole Medicare Advantage open enrollment period, what should they be doing? What are those couple steps that they should be doing?
Well, firstly, whether they contact HICAP or not, all seniors should be looking at their current plan and making sure that that plan is meeting their needs. It is not required to make changes to plans during open enrollment. It is optional. So if you have an agent that might be pushing you to make a change in a plan that you're happy with, that's not necessary. It's optional.
Okay.
Should you choose to, once you get current and knowledgeable about the plan that you have and you think you're going to want to make a change, please call us at HICAP. We have, for the next 2 months during annual open enrollment, over 50 clinics that we're offering at various senior centers and community centers around Orange County. During that time, you can make an appointment, please, to come, and during that time you just bring your drugs in a brown paper bag. Don't try and list them out, because we found errors were made in the list. Just put them in a brown paper bag, and a counselor will sit next to you and will help you using a laptop computer to analyze the different plans, and will compare your plan with 2 other plans of a similar or lower cost, so that we can get you into the best program.
So if we look here, the first step is they need to take a look at Medicare and start to really understand where they're at.
What are they on today? How is it meeting their needs?
And then the next step would be they need to really start looking at the information, going onto the website, going onto your website, looking at how they can speak with someone, make an appointment, coming in and doing this, what you called a comparison. Is that correct?
That is correct. That's what
Okay.
happens at a clinic.
Okay. So you said that there are over 50 clinics
Correct.
that they could go to all over the place and by calling one of the numbers. So as we look here, so they can call the HICAP call center, the 1-800-434-0222, and they would be able to make an appointment, and they can either come into, would you say that they need to come into the Medicare roadmap, the roadmap to Medicare at that point?
I think at this point it would be good to have them go to a clinic, an annual
Okay.
enrollment clinic, if they're thinking about making changes and they're unsure and they need help.
So at this point, probably the roadmap to Medicare is prior to jumping on, and once they're on, then it's going into the clinic, sitting down with a counselor, looking at all their information.
The clinics are
that-
for people who are currently in Medicare.
Okay.
That's a perfect way to describe it,
Okay,
yes.
good. Then I think I understand that a little bit better, and will direct people that way. So let's kind of look, though, if, say, someone is coming up on 65, so the open enrollment isn't there, so then they're looking at the roadmap to Medicare, which is twice a month, and that's done on the last Wednesday, last Saturday. And if they're not doing that, they can also call the phone bank, which is open from 8 to 4
Yes,
every day.
correct. Qualified volunteers on the phone.
And if they maybe didn't get the information, or they don't know when they're going to be in the center, they can call that number,
Yes.
speak to someone, and they'll direct them to one of the enrollment clinics.
Absolutely, and also direct them to a senior center where they can make a one-on-one appointment with a counselor as well for unbiased information on their Medicare.
Okay. So I saw in the open enrollment clinics, you're going to have some at Laguna Woods City Hall, which is October 20th. So they should be calling for an appointment prior to coming in because those slots may be filled. Is that correct?
That is correct. We ask that they call for an appointment. If they have to cancel, just call and let us know. If they're coming as a couple, please make 2 appointments and bring your drugs, your Medicare card, and your health information along with you.
And then, as we said, we're going to be doing the Medicare Marketplace. I know yourself, you'll be there, I'll be there, and many other just great information, a great time for them to come out to on the 22nd. But if they're going to take place in that clinic, if they would like, they also should be calling and setting up an appointment.
Yes.
Okay, because I really want to make sure that they understand it's not a type where you can just walk in. They need to call, set up an appointment, set up that time slot for them so that we make sure you have someone there for them, a counselor that will be meeting with them to go over their information, let them know what they should be bringing in.
Yes.
Okay, perfect. So we have October 20th at Laguna Woods City Hall, and then we have on October 22nd at Laguna Woods Clubhouse number 5.
Yes, correct.
And they can come and hear the presentations. The doors open at 9. They can be there and cover that. So I think we're covering some great information there as far as what they need to do. So kind of start as we wrap up, and I greatly appreciate, Susan, you coming in today just to share this information, which I know the viewers, if they didn't see it, I'm hoping they're telling their friends that didn't get a chance to watch it, and they're sharing that information. So let's put up the information. It's there. This is how they can contact you. You're at you're able to help in any way that you can. Counseling and aging, it's not just Medicare. There's many other things that you're doing.
Yes.
You're right in Santa Ana, which is close, a phone call away to set up. You may be in one of their centers, so you're able to help in that way, or the ombudsman, so whatever route you're going. So I'd just like to close up and put that information out there. Once again, we're going to be at the Medicare Marketplace Thursday, October 22nd. Any closing remarks from your side in the last couple seconds we have here?
Thank you for having us. I'd like to really encourage seniors to dial these numbers. You will get through to a qualified, trained counselor who will give you unbiased, very good information, accurate information, so that you can make informed decisions.
Excellent. Thank you. We look forward to seeing everybody out at the Medicare Marketplace, or call and get in touch with the Counseling and Aging in the HICAP program. Thank you for being with us today. I wish you all the best. it'll be with this. It'll be with the second question. So they're.
You can put out my logo on this
Yeah,
if you've got it.
I would say the logo to start
Put up
with.
the logo.
Oh, okay. All right, you know what? Do you want me to come in there to get up his logo? Yeah, okay. There, let me get that, because it's on a different.
That's okay.
I'll only take a second, though.
So I just saw your little segment right before this.
Oh, yeah,
So-
good.
You do
Yeah,
this
we-
once a month here?
Once a month.
Okay.
And then they run it. Usually try to do it at the start of the month,
Okay.
and then they run it for
All through the month.
the rest of
Okay.
the Fridays there. So
You go by Jeffrey?
correct.
Okay.
Salud.
You can't do that during the taping, you know.
There we go. That looks nice.
Okay. Yeah.
Hello, folks. This is the retirement professor, Dan O'Weiler with Sterling Financial Advisors. Over the last little while, you've seen some of my segments discussing different financial items and things that affect our retirement. Today, I'm going to be doing a segment with Jeffrey Rodriguez, who is a representative from the Social Security system. It's great to have him here today, and thought we could discuss some of the items that I find that as I sit down with people, they have questions regarding their Social Security. So welcome, Jeffrey. Good to have you here.
Thank you, Dan. Appreciate the opportunity to come on.
I know that you've been here from time to time talking about Social Security issues, and
Correct.
And hopefully people take advantage of that information. But I just thought I'd ask you some specific questions regarding that I have clients ask me, if that's okay.
Yeah, let's do that. That sounds great.
Okay. Obviously, one of the first questions I have asked me is, Dan, when's the best time to start taking Social Security?
Well, that's
And
a
I
great
wish I had an
question.
answer for that.
Yeah, exactly. And I think that you'll see as you've helped. I know that you've already kind of seen it. It really depends on so many factors. And when I'm out speaking, I do my presentations. There isn't one real good answer, except maybe the only one that I do give in jest is, if you can tell me one thing, I can figure out exactly, you know where I'm going, tell me when you're going to die.
Tell me when you're going to die, I'll tell you what to do.
Exactly. So other than that, then we're really looking at, there's financial factors that need to be taken in place. When do you need the money?
Right.
You know, definitely someone doesn't want to live homeless to be able to
Right.
wait for delayed retirement
I
credit.
want to wait till we get the maximum benefit,
Yeah.
so I'm going to be in poverty till
Yeah,
then.
that would not make any sense.
Right.
Lose a home, not able to pay the rent, something
Sure.
like that. So they need to look at the financial aspect of it, as well as health.
Okay.
How long do they really plan? They need to be
Right.
honest with themselves, and that's one of the things I do go over in the presentations and let people know. You just need to be honest with yourself.
Right.
What is the history, your family history?
Sure.
You know, when do you expect? Do you expect to live till
Long
90?
life expectancy comes into play.
And we've already seen, and one of the things that has really impacted recently is that people are living longer. Now, that's not a problem. That's a good thing. My mom's 83.
Right.
I wanted to live even longer. But, you know, so it's not so much, you know, oh my gosh, the statistic. It's, yes, that's out there, and medicine, that helps. But the person needs to look at, well, how am I feeling?
Well, I know
What's
you
my
can start
record?
taking it at age 62, right?
Correct. 62 would be that first
Right.
stage.
And that's a early benefit, so to speak. Full retirement is 66 for many of us. Is that correct?
Correct. If
I-
they're born, you know, depending on the years of birth, as we get past, really right now, anyone going in is still in the 66. They're going to graduate up to 67. Then those born after 1960 at that 67 still remains to be seen with, you know, future changes.
I know it depends on the amount of benefit that you're going to get, but has there been any kind of guidelines of how long it takes to kind of break even if you start at age 62?
Yeah, it's still just mathematical.
Okay.
Is someone figuring out, well, if I start it now, is it beneficial? And the easiest way that I can explain it, and what I say is, if you're taking it earlier, meaning a reduced benefit, is because you want the money now.
Right.
You're planning to do something, and you want to either, whether it's investing it or you just have another goal in mind, and you say, you know what, I'll take it now at the reduced amount. I understand that later on it means I'm really truly getting less,
Right.
and that's fine. But at the moment, you're saying I need it. If you're delaying it and you're waiting for either that 66, the full retirement age, or age 67, or you're waiting to 70 with delayed retirement credit, you're saying, I plan to live long and I want it when I really can't control income anymore,
Right.
and I'd rather have the higher paid benefit there.
From age 66 to 70, how much does it increase our benefit if we decide, hey, I'm still working, Dan, I don't need the Social Security, so I'm going to wait till age 70 or as long as I can. How much does it increase from age 66 each year?
Yeah, and it's 8% per year.
Okay.
So it's a straight 8%. So if they wait from 66 to 70, it's additional 32%.
Okay.
Which makes a lot of
Sure.
sense. I mean,
it's
you
a
tell me,
sig-
you're a financial
Well,
advisor. Where are you going to get that type of investment?
Right, and that's what I tell people as I sit down with them. It's a guaranteed 8% return on your money if you can afford to wait.
Exactly,
You
and
know,
that's
so-
the question.
So there's really a significant amount of difference if you start at age 62 as opposed to what you would get at age 70.
Correct.
There's a tremendous amount of difference.
You know, when people look at it, 25% reduction to take it
Right.
at age 62, or we do monthly reductions, so if it's 63 or 64, maybe, you know, 20, 40, whatever months we're going to reduce it by.
Is that what the difference is 25%?
It's 25% at age 62.
Okay.
And each month, since we do the monthly reduction factors, it works out to about 0.5% per month.
So if you take 25% that you take as a reduction, plus the 32% you would get, that's like,
Right.
you know, over 50%.
it's a huge swing.
Yeah.
Exactly. And
Yeah.
so people really need to know, because what does occur, once you start your benefit, that's the amount that you're agreeing to, and that's what we're going to ask during the interview and the whole process. That's the amount that you're agreeing to. So that will be your benefit for the rest of your life.
That's what they should count on. Don't count on any increases or
Right.
whatever. If COLA increases come, that's kind of icing on the cake, but you should understand that's what your benefit
Exactly.
is.
We made the announcement yesterday, and we sent out to everyone to say, hey, here's what you can go onto our website, look up Social Security Matters, which is our blog, and you'll see the information, you know, about what happened and why there's a zero increase as far as the cost of living. But exactly, that's exactly what I say. Don't count on it.
Right.
What you agree to, that is your benefit.
Right. So as I sit down, and people ask me this, you know, when's the best time? And I say, tell me what's going to happen, I'll tell you what to do. There's really not a best time for everybody. I think I mentioned to you before when we've talked that I've seen flyers or advertisements say there's over hundreds of ways to claim Social Security. I'm not sure how they come up with that number, but
neither do I.
I'm not sure that there is a best time that says I should wait till 66 or 70. Like you said, I think it's all numbers depending.
Oh,
if
it
you're still
definitely is.
working and don't need the income, there's no sense taking it, I would think.
And again, whatever the needs are, because they also have to factor in here, Dan, is say they don't want to take it yet because they're working or whatever the case may be, but they can file and suspend, allowing a spouse that maybe has not worked, that you raise the children, that stay-home mom, then she now turns 62 and she wants to jump
Right.
on and start receiving her 50% of that benefit that she's eligible to.
Sure.
Well, the only way that can happen is he either has to delay it or start it and suspend it for himself, or start receiving his benefit. So you also have to look at how many others. Maybe they have a child that's under age 18, and maybe, or two children. I've seen this happen before. So by starting, even though it's at their full retirement age or age 65 because they've already stopped working, and they can start their benefit, now there's 2-3 other people that can jump on.
Right.
Income now raises.
That happened to my wife when her father retired. She was under age 18.
Exactly.
Was
So there
able
you
to
have
receive
it.
some
So
Social Security.
it would make sense, instead of waiting to where, well, I want mine to be, you know, a little bit higher,
Right.
and so that they wait for their full retirement age or into delayed, but now they missed out on 50%. So let's say someone at $2,000, you're giving up $1,000 per month for that dependent, that auxiliary child or a spouse for however many
That's part of the
time.
hundreds of ways that you can fly.
Right, yeah, we
probably,
could,
you know.
I could create a million ways if you want to look at it that way, exactly. And,
Sure.
and a lot of those are just kind of gimmicky. It's
Right.
you know, they're just trying to hide and make something as if it's brand
Right.
new and there's just new options they have. There isn't. It
Well,
is very, you said and earlier, and I'd want to key in on that, it's very individual.
Sure.
Each person, even between spouses, they have to look at it as an individual.
Right. Well, I know that there's some other topics that we wanted to get into, and maybe we can sit down at another time and go over those with you.
Sure,
You know, if
that'd
you
be
don't
great.
work, are you qualifying for Social Security, those types of things. But I think our segment here is running a little bit close, so
All right.
why don't I have you come back in? We'll tape another segment, and we can get some more information to these folks. If you have questions, folks, I've got a Social Security Decisions pamphlet that you can get from us. If you'd like a copy of that, kind of answer some of these questions, call our office at 949-859-8900. We'd be happy to send that out to you. Again, if you'd like a copy of that Social Security brochure, give us a call. We'll be glad to send that out to you. 949-859-8900. This is Dan O'Weiler, the retirement professor. Look forward to talking to you soon. Okay.
That's great.
All right.
There's so many ways.
Break even if you
Yeah.
start taking it at 62.
That's kind of the norm.
You know.
And you know, depends.
So if you're going to
again
live
on the
past,
We're clear for now. You want to take a moment and then we'll start again? Or you guys know?
I'm ready.
Okay,
You know.
they're ready.
How'd we do?
You guys were great. That was great. It was 9.5, so
Okay.
it was perfect. Right?
Okay. All right.
So jump in one more segment.
Which one would you prefer doing?
Well, let's do this since we didn't use the slides.
And we kind of talked about the hundreds of ways.
So they can put the slides up because they're going to post this.
Okay.
Yeah.
So which one would you prefer?
I would still, because we didn't really go fully in what is the spouse. If you find
wanna
that
do 2 and
value
3?
added,
Or-
yeah, because we can wrap up easily with that last one.
Yeah. Right.
So if we go, and here's the slide. So if we
How
talk
do I
about
qualify for retirement?
how the person qualifies,
Okay.
we can start there
Okay.
and then explain. So then we say, well, maybe if the person doesn't qualify, what about a spouse that didn't work because it was a one
Okay.
income type? Well, then this is how they would do it.
Okay.
And then say, well, when they're ready to file, how they do it, and then
Okay.
we jump to there.
Sure.
Does that
All
work?
right, ready? You guys ready?
Ready.
Stand by. Hold on just a moment.
What slide number is that, Jeff?
How
We're
to
gonna-
qualify.
We're going to go straight in the order.
Straight in the order, so show all three in a row, right? Okay, stand by.
Hello, folks. This is Dan O'Weiler, the retirement professor. I'm sitting here with Jeffrey Rodriguez from the Social Security Administration, here to answer some questions regarding Social Security. Jeffrey, welcome today.
Thank you. Appreciate it.
I know that from time to time you're on the network here talking about Social Security, trying to get information out to people on how they qualify, and I thought that I'd sit down with you, ask you some questions that I get from clients along the way to help people kind of understand a little bit better what the Social Security system is and how it works in our lives. Would that be okay?
Oh, that'd be great. Appreciate it. And that's really what my job is, to get out there and get the information out.
The positive information,
Positive,
right?
the true, the correct
Right,
information.
right.
I won't say positive because sometimes people don't like what we say,
Well, that's true.
but it's the truth of
Right,
it. you know?
right, right.
So better than waiting for some other source of myths and all these things that are created, let's get the correct information.
Right. Well, first of all, one of the questions that I have when people come in and chat to me is do I even qualify for Social Security?
Right.
Those are things that sometimes wives will ask or people that haven't worked. How do you go about qualifying for Social Security?
You know, it's a great question because most of the people don't even realize how they become eligible.
Mm-hmm.
They just know I've worked, I guess I'm now eligible. You know, they get mixed between private pensions and what Social Security does. So the way that someone qualifies for retirement benefits is kind of a couple steps. One, they work and they earn what we call quarterly credits. So obviously quarterly 4, so there's 4 credits maximum that someone can earn in a year.
Okay.
Each
Is there an amount of
thousand,
money they have to earn?
correct. So
in order to
each
get-
1,220 in a year
Okay.
will give them 1 credit. So after 4,880, they've met their year to hit the 4 quarters.
Okay.
But you also have to remember, we're going to use 35 years of work in order to come up with their benefit amount. So if a person only works the minimum to hit the credits, meaning they've worked 40 credits equal to about 10 years worth of work, their benefit, 10 years compared to the 35 is a third already.
Yes,
The
sir.
average benefit, just a little over 1,200. I think next year or this year it came out to about 1,300.
When you say the average, that includes the people and spousal benefits as well?
Right, everybody
Okay.
receiving under retirement benefits, the average comes out to about 1,300 per person
Okay.
of retirement benefits. So if they've worked only a third of what the potential or what we're going to use to develop their benefit amount,
Okay.
a third of 1,200, 1,300, $300, $400 maximum. So the person can realize, hey, I'm not going to get very much. So, but that's still okay if they didn't really work much. Let's say like a spouse that didn't work out of the house, raised the children, and went back into the workforce
Sure.
for a little bit, may barely only get those credits.
So if she doesn't work, like you said, she raised her family, didn't work, then went back into the workforce at age 60, worked till age 66, she probably wouldn't have enough of her own credits. Would that be correct?
You know, so we're going to pull up and say, well, how many credits did you earn? And so if they don't hit the 40, there is no benefit for that person. And you know, unfortunately, that's kind of where the line is. You
Probably have to have a spousal benefit. Would
so
that be
which
correct?
moves into the next area, which is a great, you know, kind of segue into if the spouse isn't eligible, the person isn't eligible on their own record, then they can look to a spouse record.
Okay.
So a spouse, what the spouse benefit says is, since you didn't work and you took care of the kids, we're going to cover you under your spouse's record. So the
Okay.
spouse's benefit.
So you get credit for raising kids.
So to speak, yeah, it's work, it's hard work. So they'll be able to file under
Some of
that.
them might trade places with the working spouse to have the other one take
Exactly.
care of the kids.
Most of the working ones know that it's a lot of work.
Right,
It's
right.
24 hours versus an 8-hour, 10-hour day.
Right.
So the benefits for the spouse are 50% of what we call the primary insured amount. That means the full retirement age amount.
Okay.
So when someone goes in and sets up a My Social Security account and they have
There's a
access to
website,
on
correct?
our website, they'll go in.
SocialSecurity.gov or something?
Correct,
Okay.
socialsecurity.gov. So they'll
Okay.
go in and they'll see how to set up the My Social Security account,
Okay.
walk through, and once they set that up, then they're able to go in and look and see how much is that primary insured amount. So they'll see their statement, and let's say it's $1,200. So the spouse is eligible to 50% of that,
Okay.
$600 at her full retirement age.
Which could probably 66 and a half or whatever.
Depending on
Right.
when she was
When she
born
was
and
born.
all of that. So now we're looking at the spouse saying, okay, you're eligible to 50%. She can take a reduced at age 62
Okay.
as long as she doesn't go over the income requirement, which is
Now,
$15,000
if she takes
a
it
year.
at age 62, at age 66, can she go up to the higher amount that she would have gotten at age 66?
Great question. Most people think like, oh, so then it kicks in. No.
Okay.
Whenever someone starts receiving a benefit, whether it's the number holder on their own record, a spouse on their record, the moment that person starts a benefit, that is their benefit amount. So
Okay.
if a spouse receives a auxiliary spouse benefit and a reduced amount, that's the amount for
Even
the
though
rest
the
of hers.
spouse even defers to age 70, they're still only going to get the
It's
amount they
only
took
there.
at age 62.
And the spouse will only go up to their full retirement age. There's no delayed retirement credit for a spouse filing on the number holder.
I see.
So if the spouse is waiting to get the maximum amount, the true total 50%, it's not going to go over that. That would be at their full retirement age, whether 66 or integrated up to 67.
So if somebody turns age 66 and says, okay, I'm retiring, I want to start kicking in Social Security, how do you go about applying for that?
Real easy. You know, I've seen these things out there, and you've probably seen them too. You know, all these different ways someone can file.
Right, hundreds of different ways that you can file for Social
Yeah,
Security. We'll tell you the best way, right?
And maybe what they're speaking about is maybe you grab a cup of coffee and a donut, maybe
Right,
it's
right.
over lunch. I
Right,
don't know what their
right,
different
right.
ways are.
Right.
There's really 3 basic ways. The first way is to go online, which is the quickest, easiest, And I would say the most
You
accurate
can
way.
actually apply online.
You apply online for your
Don't have to
retirement
go
benefit.
down to the office.
Don't go down to the office.
Okay.
Don't have to get a hold of us. You apply online. And there's during that path, as you go through and you're filing online, if you truly have a question or need to get a hold of us, there's a section there that you can say, I need to speak to a representative. Please give me a call. We'll honor that. No problem. We'll speak
Sure.
to them.
Sure.
If not, then the next way, if they're not going to file online, would be calling our 800 number and setting up an appointment.
Okay.
And they'll call and either set up a phone appointment or an office appointment.
Okay.
And then the other way would be just walking into the office. But
That's
they
like
may
walking
wait.
into the DMV, without an appointment.
Yeah, something you don't want to do unless you got maybe a small lunch you're going
Right.
to go out and snack on during. We just don't know. We can never. People ask, "What's the best day?"
Right.
Who knows?
Right.
It just depends on the volume.
Now
and
you have
we
an
don't
office
control
here in
that.
Mission Viejo, correct?
We have 6 offices throughout Orange County.
Okay.
We have one in Mission Viejo, in Fountain Valley would be the 2 closest around the
Okay.
area here. Mission Viejo would be the one that covers here out of Laguna Woods.
Okay. Well, Jeffrey's been a great resource for us, for myself and the residents here of Laguna Woods. I know that you've been a great resource in the past and will continue to be. So we appreciate that. If you'd like some help, folks, in sitting down and kind of doing some retirement income planning, you can talk to us at Sterling Financial Advisors. Give our office a call at 859-8900. We'd be happy to sit down with you on a complimentary basis and kind of look at some options for you in regards to Social Security and planning. Again, not knowing the best time because we don't have a crystal ball, but obviously we'd like to sit down and maybe look at some options for you that might give you at least some things to talk about. We've got a little brochure called the Social Security Decisions that if you'd like to get a copy of this, again, give our office a call at 949-859-8900. We do complete retirement planning at Sterling Financial. Hopefully we'll hear from you. If not, we hope you have a happy retirement. Thanks so much. Thanks for coming in.
That's great.
Appreciate that.
I always tell people if they're going in